If your movement performance session indicates we need better mobility and motor control of the hip in an externally rotated position, this exercise is for you. This exercise is nearly identical to the hip external rotation half kneeling exercise with one important difference. By using a kettlebell or dumbbell with an appropriately calculated weight, we load the deep core of the spine and pelvis, which further unlocks hip mobility for many of you. To begin, be sure to anchor your exercise band securely to a pole or stairway post. Once secure, step the leg through the band, take your place in your half kneeling position. One knee is down, and in this case is turned as close to 90 degrees as possible to place that hip into an externally rotated position. Don't worry about how far you can turn your hip. With persistence, this will improve. Make sure the band is high and well up inside the hip crease. Remember, we're not strengthening anything with the band. We're simply bringing awareness to the proximal stabilizers of the hip. There is no need to make this band excessively tight or to fight against it in an effort to strengthen. That's not what we're trying to accomplish here. The other knee is up and the shin is vertical. With most of your weight over the knee that is rooted into the mat, we are requiring both stability and mobility from the grounded hip, with gravity loading both the hip and the spine. Finally, take the kettlebell or dumbbell with a weight we've determined from our movement session. Your pelvis remains in a neutral stacked position with a straight spine, and your shoulders remain squared off. Now you're ready. Without moving, take a deep inhale and exhale through the nose with this tall starting position, and see if you can relax. It may actually take you a few breaths to get comfortable. Take your time and find your balance. When you're ready, take a deep inhale, feel your spine lengthen upward as you get ready to lunge forward. As you exhale, relax the front of the hip that is rooted into the mat and squeeze the glutes on that same side to gently lunge your hip forward as far as you can comfortably and without pain. Stay tall through the lunge, letting the knee that is raised come as far forward as possible without the heel leaving the ground. This is the end of your exhale. As you begin to inhale and return to the starting position, don't lean backward with your back. Simply stay tall and balanced through the hips and spine. At the end of your inhale, you've returned to the starting position. Bring some awareness to what you're noticing. How does the breath feel as you press into the lunge? Is it hard to keep the hips and lower back stacked without bending the spine or losing control of the hips? How's your balance? Can you find a rhythm to this motion without holding your breath? Do you notice pain? If so, back off and shorten the motion. Perform about 15 repetitions on each side, being sure to use your diaphragmatic breath to improve your segmental control of the motion. Again, do not push into pain. After that, it's about consistency over time. If we're sure you have the right diagnosis for your movement dysfunction, then stick with it and you will find the freedom you're looking for. Are you wondering if this exercise is right for stiffness or a lack of control in your spine or hips? Are you looking for better balance and more core stability? Just click the schedule button and let's make sure you're not wasting your time practicing exercises that may not help. Thanks for watching. I'll see you again soon.